So what are the biggest challenges and how Nordic is going to solve the problem?
One of the biggest problems from the clinical perspective, I'm a physical therapist.
How Nordic is going to help the customers or hospitals to solve the problem? While implementing the AI, how important is the governance? Welcome to our podcast. Today I'm in conversation with Siroris, the Managing Director of Nordic. Welcome to our show.
Thank you very much. I appreciate being here.
Okay. So tell me about what Nordic does.
So Nordic is an end-to-end healthcare only consulting firm. We started in the Epic staff augmentation space in 2010. We have since evolved. We have full managed services all the way through to what I lead, which is the clinical transformation and innovation services. So more of a management consulting and advisory, helping customers not only develop and execute on their strategic priorities and operating models, but then to leverage their technology platforms and their investments to gain the most value from the data that they're receiving, use that data in meaningful ways to create exceptional patient and workforce and provider, nursing, clinician experiences.
Okay. So what are the biggest challenges the healthcare organization face today and how Nordic is going to solve the problem?
Okay. So one of the biggest problems from the clinical perspective, I'm a physical therapist by clinical background. One of the biggest problems is going to be burnout. The rate of change is not going to stop. It's going to accelerate, right? So there's always going to be new technologies coming into play with the intent to make work easier. In order to leverage a technology and get the most value out of that investment, requires people to change what they do. It might require them to change their job role, and change is really hard to do. And so it further burdens, even though it's intended to make things easier, further burdens the workforce, right? That's stressful. And so that's one of the biggest things is how are organizations embracing a discipline around enabling change so that they can truly receive the value from their technology investments and get what they expect to receive, whether it's improved efficiencies, better quality of care, better patient outcomes and patient engagement, etc. So burnout's one of the top problems.
Today we have a lot of AI solutions in the market.
Okay, AI
and
solutions.
all the hospitals wants to bring the AI robotics into their hospitals and solutions, right? How Nordic is going to help the customers or hospitals to solve the problem?
So preparing for that change. So one, the AI is only as good as the data that informs the algorithms, right? So if you're taking, for example, clinical documentation, clinical notes that are just immense in length because they have evolved over time, just as a matter of fact, right? Just continuing to customize the templates, then the algorithms are being trained on very lengthy templates. So you need to get down to standardizing those activities so the algorithms are trained to develop, to put something out that is actually user-friendly as opposed to a whole bunch of stuff in, you get a whole bunch of stuff out. So that's where we're starting to see some improvements. Nordic can help solve that problem by working on that documentation standardization, if you will, just to start with something very simple. There's also the interpretation that AI is new, right? It's not necessarily new, it's accelerated, right? Exactly. So we've been using clinical decision support for years.
Wow.
Alerts to allergies, alerts to medication interactions, alerts to gaps in care. That's all early AI. It's now using generative AI like at the point of care, in the moment of care delivery, or in the business functions that support the running of the organization where you have these overhead costs that are enabling the business itself, but AI can be used in ways to minimize the need for the human touch and allow humans to do the job that humans are uniquely qualified to do.
Right.
And the AI can do the stuff that computers do. It's not going to replace the human. It's going to elevate where the human adds the most value.
Right, that's interesting.
Yeah.
And many hospitals are preparing for the CMS solutions. How Nordic is going to help the hospitals and all the customers for implementing the CMS solutions?
Okay, so the CMS team program, the Transforming Episode Accountability Model program, is an evolution of bundle payments. Bundle payments have been around for many, many years. CMS said we have to reduce cost around 5 specific surgical groups, 19, I believe, DRGs, give or take. And we're going to look at it over the 30-day continuum of care from the time of surgery through 30 days post-op, whether that patient goes to outpatient, to home care, to the skilled nursing unit, to rehab, etc. So hospitals need to better understand and coordinate the journey, whereas they might have only been responsible for a piece of the journey at the beginning.
Okay.
Now they need to understand where that patient is going 30 days. So they
30
have to
days
be
now.
thinking about their community relationships, their referrals, their post-discharge sites, and how they integrate that care. So what is Nordic doing? We're offering complimentary workshops to our customers to understand the implications of the CMS team program to their bottom line. In some cases, organizations are at significant risk for loss over the next 5 years. The program's compliance is required in January 1, 26. It's a 5-year program. In other cases, organizations have the opportunity actually to improve their financial position, and so you want to accelerate that. Coming out of the workshop, we're seeing two major asks, at least at this point in time, as organizations are in the planning stage.
Right.
One is a much more detailed, data-informed, using their own data, data-informed roadmap that puts in place the plan to comply with the requirements in January 1. On January 1. The second is maybe they're just really interested in understanding the analytics component to it.
Yeah.
So we're standing up a quality program because it's not just the team program.
Yes.
Many of the performance measures already track back to other quality programs. We have a super strong quality program within Nordic to allow for the analytics and then support in interpreting and understanding where the opportunities for improvement are.
Right. Very interesting. And you see a lot of companies want to implement the AI, and in 2025, how the companies are prepared, or what are they looking for in terms of AI, and how you guys are better prepared for implementing the AI for your customers?
So first is saying, what is the use case? What is the problem that you're trying to solve that then you can leverage AI into improving that process? So we have a revenue cycle team who can help automate a lot of the back office side of things and leverage AI into the revenue cycle process. We have a team to support the your access to care, your call center automation. Again, it's putting together the use case for what type of patient population are you responding to, and how are you going to leverage AI, maybe chatbot functionality, to triage a call and direct them to the right area. We have my team that does the clinical optimization side of things. So understanding where are you leveraging AI to help a physician understand or retest faster, right? Are you trying to leverage AI to identify gaps in care and do automated outreach to patients to resolve that gap in care, so that you get in front of a screening process rather than letting a disease progress and ending up with a worse outcome than you'd want to have. If the screening hadn't been done, care provided early on in the process, patient goes back to living a healthy life. So there's a lot of ways that Nordic can help organizations prepare for AI. We also have the integration component from the back end. We have a tremendous team of digital health experts and interoperability experts that help ensure the quality of the data. Again, the AI is only as good as the data that it's trained on,
Right.
and the systems and incorporating it into the workflow of the clinicians and the workforce. So it's not something that is separate. It becomes innate to the processes and how they work and care for patients.
Very nice explanation. And while implementing the AI, how important is the governance?
At the top of the list. So the governance side of things, one, governance for the project or program overall. You've got a number of different, when people say governance, there's a lot of different flavors of governance. So the program and the project, governance comes into play. That gets back to what I said at the very beginning of understanding the impact of change. What is it that you expect? What is your current performance? What is the outcome you expect, and how do you manage the change to get there? But there is an underlying piece that is around the data governance that is at the foundation of the technology aspect of things, of ensuring you're using the right data and that there's confidence in the end users. Physicians are scientists. They want to know that the data that they're using is the correct data. Not, oh, it's good enough. No, it's not going to be good enough. So for full adoption, you need to have confidence in the data and have a full data governance structure in place as well.
Okay, nice. Thanks for explaining everything about Nordic and what is the vision, everything what you does. And thanks for spending time with us. And all the good luck for your company.
Thank you very much. I appreciate it.
Thank you.
Take care.